So today we will be studying the coagulation of the kinin pathway. PT monitors the extrinsic and the common pathway, and PTT monitors the intrinsic and the common pathway. PT is extrinsic and PTT is intrinsic. Then we will see in the pathway. First is factor 12. After the factor 12, first of all factor 12 is activated, then factor 11, then factor 9, factor 12, factor 11, factor 9, then after factor 9, 10 is not there in the order, 12, 11, 9, then after the factor 9, factor 8 is activated, factor 8, then is factor 7 is activated, then after that 12, 11, 9, 8, 7, then comes the 10, after 7 comes the 10, after 10 then is factor 5, then is factor 2, factor 5 and factor 2, then 2 leads ductation of 1 to 1a, then factor 13, fibrin stabilizing factor, fibrin stabilizing factor, fibrin mesh stabilizes the platelet plug. So how to remember the factors involved in the pathways in the serial order? 12, 11, फिर उसके बाद 10 नहीं है, उसके बाद 9 है, 9, 8, 7, 7 के बाद 10 आएगा, 10 के एक्टिवेशन के बाद है 5, 5, then is second 2, 5 into 2 equals to 10. Then at last we know we need to remember that it is factor 13 at the last. Then high molecular weight kininogen is converted to bradykinin, and which increases the vasodilation, increases the permeability and increases the pain, and it is inhibited by kallikreinin. Kallikreinin C1 esterase inhibitor inhibits factor 12 and factor 11A. Regulatory anticoagulant proteins are protein C and protein S. Anticoagulants are heparin, low molecular weight heparin and direct thrombin inhibitors, ergotaroben, bivalirudin and dabigatran. Then plasminogen is converted into plasmin. Plasmin degrades the fibrin mesh and generates fibrin degradation products. Thrombolytics help in lysing the fibrin clot, that is alteplase, reteplase, streptokinase and tenecteplase, and antifibrinolytics, that is aminocaproic acid and tranexamic acid. These are helpful in prevention of the fibrinolysis. Then anticoagulants, low molecular weight heparin, dalteparin, हेपेरिन के पीछे पैरिन आता है ना, तो लो मोलिकुलर वेट हेपेरिन के पीछे भी पैरिन आएगा, डाल्टीपेरिन इन नॉक्सापेरिन. डायरेक्ट 10 इनहिबिटर्स एपिक्सा बैन, XA बैन, fondaparinux. Then we knew that PT monitors the extrinsic pathway, and how we will come to know that extrinsic pathway, which factors? Factor 7, then is factor 10, factor 7 in the extrinsic pathway, and then all the other factors are in the common pathway. Factor 10, then 10 के बाद 5 into 2, 5, 2, then 1, and then 13. 13 is basically not a part of this, so we will consider extrinsic pathway में कौन सा factor 7, 7 के बाद 5, 2, 10, 5, 2, 1, ठीक है, ये सारे हैं. और पीटीटी इंट्रिंसिक पाथवे को मॉनिटर कर रहा था, तो कौन सा फैक्टर नहीं इंक्लूडेड होगा? 7 नहीं इंक्लूडेड होगा और 13 नहीं इंक्लूडेड होगा. ठीक है. फिर है हीमोफीलिया ए है जो डेफिशिएंसी ऑफ फैक्टर 8 की वजह से होता है, एक्स लिंक्ड रिसेसिव है। हीमोफीलिया बी डेफिशिएंसी ऑफ फैक्टर 9 की वजह से होता है, जो एक्स लिंक्ड रिसेसिव है। और हीमोफीलिया सी है जो डेफिशिएंसी ऑफ फैक्टर 11 की वजह से होता है, जो कि ऑटोसोमल रिसेसिव है। फैक्टर 8, 9 एंड 11, 11 इज ऑटोसोमल रिसेसिव। PT sample kept at PTT and APTT. Sample is kept at room temperature. Test is done within 2 hours. Normal is 11 to 16 seconds. PT APTT है, मतलब नाम भी बड़ा, तो नॉर्मल वैल्यू इसकी पड़ी है 26 to 40 सेकेंड्स। DIC में, लिवर डिजीज़ में और ओरल एंटीकोगुलेंट्स। ओरल एंटीकोगुलेंट्स इस विटामिन के एंटागनिस्ट होते हैं। वारफरिन बेसिकली इफेक्ट करता है फैक्टर 2, 7, 9, 10 को, और 2, 7, 9, 10 है जो वो बेसिकली इन्वॉल्व है इन दी एक्सट्रिंसिक पाथवे एंड liver disease, heparin or other anticoagulants. So massive transfusion with plasma depleted RBC. This is involved in the APTT pathway. Then how to remember the factor names? Clotting factors. Foolish people try climbing long slopes after Christmas. Some people have fallen. Foolish people try climbing long slopes after Christmas. Some people have fallen. Factor 1. Foolish fibrinogen. People prothrombin. Then is trithromboplatin. Climbing calcium. Long slopes, labile factor, stable factor. After Christmas, antihemophilic A and Christmas factor or antihemophilic B. Some people have fallen. Stored power factor, plasma thromboplastin antecedent, Headman factor, and fibrin stabilizing factor or Lucky-Laurent factor. Okay, so we have remembered the names. Foolish people try climbing long slopes after Christmas. Some people have fallen. Fibrinogen, then is prothrombin, thromboplastin, calcium, labile factor, stable factor, antihemophilic A, Christmas factor. Then is stored power factor, plasma thromboplastin antecedent, Hagman factor, fibrin stabilizing factor. High molecular weight kininogen is also known as Fitzgerald factor, and pre-K is pre-kallikrein. Then T half. Fibrinogen 2 to 4 days, 3 to 4 days for prothrombin. Then is factor 5, 36 hours, 4 to 6 hours, 36 hours. Then is 4 to 6 hours, then is 8 to 12 hours. 5 के पास 6 नहीं है, फैक्टर 6 इज नॉट देयर. 36 hours, 4 to 6 hours, 4 to 6 का डबल 8 to 12, 8 to 12 का डबल मीन्स 24 hours के नियर अबाउट हो गया दूसरे का. फिर उसके बाद है 40 to 60 hours, 10 वाले का हो गया 40 to 60, फिर 11 का 40 to 70, फिर 60, मतलब नियर अबाउट 60 आवर्स है. 10, 11, 12 का नियर अबाउट 60 आवर्स है. इनका था 4 to 6, 8 to 12 और उससे डबल 3 बार डबल हो रहा था. 7, 8, 9 का था जो. फिर 10, 11, 12 का 60, 60, 60 के नियर अबाउट है. फिर फाइब्रिन स्टेबलाइजिंग फैक्टर का 11 to 14 डेज है. 11 to 14 डेज. हाई मोलिकुलर वेट का 150 आवर्स और इसका 35 आवर्स. 150, 35, 11 to 14 days maximum. Then is 60, 70, 60. Then is 24, 12, 6, 36 hours. And then is 2 to 4 days and 3 to 4 days. That's all.